We'll have Dr. Debraj join us. Everyone knows him. He's the director of the aesthetic clinics, runs a very successful cosmetic fellowship program, which gives you a good hands-on of injectables as well as the dermatological aspect of it. And he's now gone ahead beyond India and is now one of the early Indian members to be on the board of facial cosmetic surgery and the American Association of Facial Cosmetic Surgery. Debraj,
Thank you.
Please.
Thank you. Thanks, Adit. Thanks for your kind words. We've been doing this for a long time together. We've been friends. Adit and I come from the same institute. Our alma mater is LV Prasad Eye Institute. And then I started my career from ophthalmology, but my objective to get into ophthalmology was always to get into facial cosmetic surgery. So we've been doing this course for a while, and Dr. Kasturi stuck in another talk, so she'll come in. Now, why I'm saying this is because mine is on combination rejuvenation. You might find that you understand my talk a little bit better after Dr. Kasturi's talk, because she's going to be talking on the fillers. Why do we need to hear this? I mean, this was also the hall where people were talking of refractive surgery, and for people trained in ophthalmology and wanting to deal with vision, why should we treat this? Interestingly enough, when you look at the American Board of Facial Cosmetic Surgery, to which I belong and I'm the only Indian diplomate of the same, we realize that 1/3 of the diplomates of the American Board of Facial Cosmetic Surgery come from an ophthalmology background. So as a result of which, in the West at least, I know at least 10 oculofacial plastic surgeons in the US who are friends of mine, whose main surgery actually is rhinoplasty. It's neither blepharoplasty, it's neither ptosis, it's actually rhinoplasty. It's interesting because American Academy of Ophthalmology just recently published this review a few years ago, which said that by 2030, they expect in the US, the facial aesthetics to become one of the top earners in ophthalmology practices. These are not oculoplastics practices, these are ophthalmology practices. And that is something which is very interesting. Most importantly, when you start off with Botox and fillers, you don't really need machines, you just need consumables. And so it can be an easy way to bleed ophthalmologists into this type of practice. Like Adit said, let us not forget that ophthalmologists really started off with the use of botulinum toxin for facial aesthetics, and from that perspective, it's important to recreate and reclaim that territory. I'm faculty at all of these organizations for a long period of time, and so some of the products that I'm using, I'm on their board as well, so some of the products that I'm using have been provided by them. Now let's look at what we are trying to transform. I request no pictures of the patients, please, because patients' privacy needs to be protected. This is someone who is a police officer. She came in, she wanted to look more aesthetic, and she was very clear she didn't want any surgery. You, in your mind, can turn around and think what you would rate her on a scale of 0 to 10. On a scale of 0 to 10, with 0 being the least aesthetic and 10 being the most aesthetic, what would you rate her? And what are the reasons for that? But incremental changes on the face can make a massive difference. And small 1 millimeter changes can make on the face are literally like an inch everywhere else. Please don't record the patient slides. And when we move to this patient, 8 years later, you can see how the face is getting transformed. Ultimately, facial aesthetics is about, please don't record patient slides. Please, I request you, please don't take patient photographs. So when you look at the way the patient has undergone a transformation, and this is all non-surgical transformation, you are aware what can be done. Now, this is also important when you look at under eye problems, right? You look at the under eye, you are an ophthalmologist, you see under eye dark circles, you say, okay, let's go and do fillers. What you're not understanding is that is the sagging of the entire facial tissues which is causing the under eye dark circles. Unless and until you have mechanisms to pull all the facial tissues upwards, whatever you do will be haphazard and not holistic in nature. We all understand, we all know this curve, we all understand that it's the S-shaped curve which is seen in youth, typically in younger women. And if you think of facial aging, what exactly is facial aging? It's all your facial tissues being pulled downwards by the action of gravity. So if all your facial tissues at any day or any moment of your life are moving downwards and medially, anti-aging therapy should be resulting in the upwards and lateral movement of the tissues. The same thing which is causing your under eye dark circles or your under eye tear trough deformity is also causing your nasolabial folds and is also causing the loss of definition in your chin and in your neck. So that's important to understand to treat people holistically. We all understand that as our testosterone levels go down, men enter their 40s and women enter their 40s as well. The estrogen levels tend to drop. These hormonal changes cause a redistribution of the facial fat. We also understand that there is also a bony change which is occurring. For instance, there is an absorption of the bone, plus the dentition is becoming smaller, plus the skull is rotating. All of this means that you have less and less support on the face. For lack of a better analogy, it's almost as if the face is falling, or the soft tissues of the face are falling off the hard tissue and they are beginning to hang downwards because of the lack of support. Or in a better way of knowing it, your soft tissue, which is really the bed sheet, is becoming more and more, because most of us are putting on weight as we age, but the bed, which is your bone, is becoming smaller. So that leads to a crumpling of tissue and an accumulation of tissue. If you understand this concept, you understand how fillers are used for facial contouring. Now, we wanted to see what aging on the Indian face looks like. And this was our study which was published in 2020. This was also rated by the Plastic and Reconstructive Surgery Journal, which is the flagship journal of the American Society of Plastic Surgeons, as the best paper from South Asia that particular year, 2020 and 2021. And just like when you do a slit lamp examination, what are you doing exactly on a slit lamp examination? You are trying to identify patterns which give you an understanding of how diseases are occurring. Similarly, aging is all about understanding patterns. Just look at these photographs, serial photographs, and see how the 20-year-old face morphs into the 30 and the 70-year-old face, and what happens at age 76. Look at this lady as she goes from her 20s, and when she reaches her 50s, see how her jawline starts to lose contour. At the same time, there is a tear trough deformity which is forming. The cervicomental angle is not as sharp as before. And you can see what I just explained. Everything's moving downwards. Mother gravity, ever so kind, is pulling everything downwards. Men have another variable as well. We are losing hair. And as you're losing hair and your forehead is becoming larger, that leads to certain other changes in the facial aging. And if you had to take this woman, why is this important? Because if she came into you at 49, you need to understand where she's coming from. And unless and until you understand the patterns of aging, how will you really decipher what will be the best anti-aging therapy for her? So all in all, what we really realized is that the upper third of the face ages relatively well. So in that sense, India is not really Botox country in that sense, because you're not really having a lot of wrinkles on your forehead, etc., especially because we have melanin in our skin, which tends to protect our skin from aging from the ultraviolet rays of the sun. So you don't see, even in a 60-year-old Indian man, wrinkles on the back of the neck. You may not see it, which you will see in a Caucasian, blue-eyed, white-skinned person. It is really the mid-face and the lower face and the neck which is aging in Indians, and it is basically this which needs to be redressed. So if you don't redress this, anything you do in the under eye areas is going to be superfluous and not going to handle the entire face holistically. We all understand that there are nasolabial folds, there are these laugh lines which develop, and we already explained how they happen. And if there are very simple laugh lines like these ones, this is a very superficial laugh line. This literally we could teach someone in the audience to do in the space of literally 5 minutes, right? It's a small filler procedure which takes about 5 minutes, done in the precincts of your office. You are taking a low G prime filler, layering the line, and the line becomes almost absent. Hyaluronic acid being the way it is, it will also absorb some water, so this line will completely disappear in the space of 2 weeks or so, depending on what sort of osmolarity of the thing you're using. Now let's look at this particular patient of ours. This patient came in because she wanted a ptosis surgery. Ptosis surgery, why? Because the patient thought that one eye looks very different from the other eye. If you also look carefully, you can see that there's a telltale sign. The right eyebrow is higher than the left eyebrow. There is also an inferior scleral show which is there on the right side, which is not there on the left side. The moment the person smiles, please no patient photographs. The moment the patient smiles, it becomes very clear that the left eye is actually becoming smaller. When you pay attention to the fact that she is a model coordinator who also models, and she's always under the gaze of the high definition camera, you can understand why this is distressing her so much. But there is no problem with the upper eyelid. She has gone and she has been suggested a ptosis surgery. There is no ptosis. If you look at MRD1, it's almost the same. It's actually the difference or the orbital dystopia and the position of the lower eyelids which is making this problem. So why do you want to do surgery? And what we did, or what we are doing continuously for this patient who's been under follow-up for 8 to 10 years now, is we did 2 units of Botox in what we call the hypertrophic orbicularis oculi to flatten that out, that roll below the eyes. You must have all known patients who, when they smile, their eyes become so small, right? Either their teeth are seen or their eyes are seen. And to make both seen, sometimes the Botox in the pretarsal area and the lower eyelid makes a big difference. And then just a little bit of fillers, which is done with the bevel down, a low G prime filler, which is done in the tear trough deformity, and the objective of this is to fill up the trough. Moment you do this, this is how she looks. The moment she smiles now, you can see how symmetrical she is. So she's literally gone from there to there. The fillers in the under eye area, are going to last for approximately 18 months or so. The Botox is hardly 2 units of Botox, costs hardly 700 rupees to the patient, and it's going to last about 3 months or so. What I'm trying to say is, if you turn around and think that surgery is the only option, if the only thing in your tool bag is going to be a hammer, everyone's going to look like a nail. So it's important to have different tool kits available. For instance, look at this lady. She's 36. She's got this asymmetrical face. She's got this under eye bag specifically on one side, right? She doesn't want to undergo surgery. You can say blepharoplasty, but she doesn't want a blepharoplasty at all. What would you do? We did a filler. So you can either remove the fat bag or you can camouflage the fat bag. So that's an important technique to know. We've done the filler. This is immediately post the filler. You can see the injection marks can be seen still. 1 week later, look at how the lid cheek junction changes. Look at how youthful her face looks. The rest of the asymmetry is there because she didn't want to address it. But you can see that that entire orbit on that side, the face on that side, the eyebrow on that side is asymmetrical. That is what you will find. And that's why it's important to be able to treat it in multiple ways. We also use lasers a lot, and 2 of the lasers which are our workhorse lasers, which we use literally in every patient of our surgery or otherwise, are the fractional CO2 laser and the Q-switched Nd:YAG laser. The Q-switched Nd:YAG laser works really well in pigmentation, especially when you've done and addressed the volume loss by doing a fat grafting or doing fillers. This does well in removing the dermal pigmentation. You can also use peels. You can use Cosmelan. There are so many peels available which can do it. And fractional CO2 is for those thin lines which you see, which is used for rejuvenation. Now let's look at some of these patients, right? Look at a combination treatment of trichloroacetic acid peels, lactic acid peels, and some Q-switched Nd:YAG laser, and the difference that that creates. Look at this patient who otherwise would have been a surgical patient, but we treated with fillers and some CO2 laser on the skin side to tighten the skin in order to make these disappear, right? Everyone will not want surgery, especially in young patients. Even if you've repositioned the fat, I have patients 10 years ago we did blepharoplasty on. They come back sometimes with fat bags again. How many times can you do a surgery? Those are also considerations that need to be considered, right? And doesn't matter how good a surgeon we are, please don't take patient photographs. Excuse me, sir, please don't take patient photographs. So if you look at this particular patient, you can see that there is under eye hollowing. There are these thin lines which are there. There's also pigmentation. People will come with multiple problems. You can't just treat one aspect of it and take it away. There was this interesting study which was published by L.V. Prasad Eye Institute, which showed clearly that when ophthalmologists do LASIK surgery, people sometimes end up being even more unhappy. Unhappy why? Their vision has cleared. You remove the glasses. Now the under eye dark circles can be seen. So using all of these things are important because ultimately patients deserve to be treated holistically. That's a patient of ours, 46 years old. She didn't come in because she wanted to look young. She didn't want to come in because she wanted to look pretty. She came in because she wanted to look rested. She said, I look tired, I want to look rested. Is there something you can do for me? People think I'm lacking in energy. We did a little bit of Botox, a little bit of fillers. Adit talked about the Botox, Dr. Kasturi will talk about the fillers. But essentially, she went from here to here in the space of like 2 weeks, right? After the Botox and the fillers have settled, this interestingly is a patient from 2006. That was the time we didn't even have the high grade or the high G prime fillers we do today. But even with the low G prime fillers and the Botox, everyone uses the same guns. People don't get the same results with the guns. So that's important to understand technology well. Now, another patient, different patient, very heavy face, Middle Eastern patient from Oman. She's got this mountain above the valley. Unless and until you can get the mountain to move upwards, you are not going to be able to just use fillers in her. So utilizing high G prime fillers properly on the lateral part of the face in order to increase the structural support and allow the face to be pulled laterally from where it's coming or hanging down, and then using low G prime fillers in the valleys will give you good results, allowing the person to look rested. The reason some people or some celebrities on television look funny with fillers is not the fault of fillers. It's just injectors who don't know how to inject. You don't know how to do a certain thing. For instance, a LASIK machine that you guys use is useless in my hands, right? So it's knowing how to use things and using them well, right? Face thread lift is something we do regularly, and this is an office procedure where we insert threads into the face. These are like barbed wires which are completely absorbable, and it's a non-surgical facelift which gets done, inserted into the face, uplifts your face, makes the face look tighter, makes the face look better. These threads will disappear in approximately about 9 months or so, but the results last for about 2 years, right? So if you have a heavy face like this, using threads becomes important. Using threads, you'll be able to shift the facial tissues laterally from where they came, and then you can layer the valleys, etc., leading to these sort of results. That's also a patient who's undergone carbon dioxide laser resurfacing. That's why she has those scabs on her skin, which has been done. Look at her face. She looks angry, right? Or she looks very sheer. Just changing the metrics and using fillers, threads, Botox, etc. could give you a nice, more pleasant looking face, right? Ultimately, perceptions are reality. That's also the reason when you give a gift, you want to give it in a good wrapper. That's what our faces are. That's our present to the world, if you will. There are other devices, etc. There's just so much in facial aesthetics. I don't think I can do justice to it in 15 minutes time, but things like the Altera, which are non-surgical facelift devices, which basically are what technology that is being transforming the face. So essentially, these are devices which do a facelift, right? You literally, it's like a probe which is going on the face, releasing high intensity focused ultrasound energy on the face, allowing the facial tissues to be lifted up, causing the under eyes and every other part of the face to look better, right? That's our paper, which was published on the Altera in the PRS. And this was the first paper from India. Look at this lady and look at how her jowls and her neckline look so much more defined. That's an almost surgery-like result, but done without surgery, done with the Altera. Another patient of ours with the Altera. Certain other machines as well, too many machines, but all in all, technology's got to the stage where surgery or our facelifts have reduced by almost 60-70%. We don't need to do surgical facelift. Just like in ophthalmology, aesthetics is a very technology-dependent branch, and depending on the technology that you can use, you can do a lot. Some people will need surgery, so we do the mid-face lift very regularly, and that's a small 45-minute procedure done from the supraciliary sulcus inside the mouth, and then you take the sutures up behind, and there's an incision which is behind the hairline. So essentially you're lifting up the cheek. One incision is inside the mouth, one is behind the hairline, and you can literally see how the cheek gets lifted up. And that's something that we do regularly to do a mid-face lift. Let's look at a certain patient who's undergone the mid-face lift. That's a 66-year-old lady who came into us from Utah in Salt Lake City, and she underwent a blepharoplasty and a mid-face lift and carbon dioxide laser. She's still 66, but maybe her soul, which was younger, now matches the face. Another person who came in, a 70-year-old, you can see there's dermatochalasis, needs a upper and a lower eyelid blepharoplasty, but just doing a upper and a lower eyelid blepharoplasty is not going to cut it. You will have to treat the rest of the face as well, because if you don't do that, then you will not be able to do justice in giving the patient a holistic look. One more of our mid-face lifts. This patient was actually operated just 3 weeks ago. We've been maintaining her. She's 44. We've been maintaining her on fillers, etc. for a long period of time. But as she's aged, you can see that there is a little bit of a volume loss, etc., which has occurred here. And then we decided it was the right time to do a small blepharoplasty, upper eyelid blepharoplasty, do some facelift. This is 1 week post the surgery. This is just before she left for the US. You can see how the facial shape has changed, how it used to be much heavier, the lower face, and that has all got lifted up and is becoming much more oval, doing well now. Facial liposuction is also something that we do very regularly. It's reducing, of course, with the amount of deoxycholic acid we've started to use now in the lower neck and the face areas and in the jowl, which is a lipolytic solution. But essentially what you're doing is taking tissue from those areas which are very heavy and repositioning them to the upper part of the face from where they came. So imagine a lady like this, 46, right? But see the difference that the change in the facial shape makes, because you can literally take the facial tissues from the lower part of the face and transposition it to the upper part and make a difference. One of my last patients now, 48-year-old patient who came in from Lebanon. I won't tell you the reasons why, but she came in and said, I look aged, I want my dignity back. And that's how we gave her dignity back. Giving her a number of non-surgical treatments, making sure that the facial shape changes, and understanding the tenets of aging so that we can then go ahead and retransform or redrape the face and do it in a non-surgical manner, in a predictable manner, makes all the difference. Few other things before I move on. Everything doesn't require surgery. These were results which until 15 years ago we had to rely on shaving the angle of the jaw to produce, but this is something which can now be done even with Botox. This is a Botox in masseter hypertrophy which we've utilized. These are serial pictures which show the change in the facial shape, and our paper on this, which was actually published in PRS, showed that if you do 4 sessions of these, the results can last up to 4 years or more. Rhinoplasty, surgical rhinoplasty is very common in our practices, but everyone doesn't need a surgery. You can actually do fillers. And I will just go ahead and show you one patient to showcase what differences we can create. For instance, this is a patient who's an actress. She is from Marathi cinemas. And she came in, she didn't want a surgical rhinoplasty. You see, she's got a nice nose. But the moment she smiles, you can see how that nose drops down. Using fillers, using threads, etc., you can transform the angle also. This is something which if we were doing a surgical rhinoplasty, we would need a columella strut graft. And we've been able to achieve it without a strut because of the way we use high G' fillers, etc. now. I'll bring my talk to an end now. All in all, facial aesthetics is a rapidly expanding branch. A 1.5 hour vast session can't do justice to this, but obviously there are ways and means by which you can learn this. We have dedicated our lives and our careers to this, and in case you think this is useful, please come down and we'll be happy to teach you some of these techniques and take it from there. Over to Dr. Kasturi, for whose talk we've been waiting till now.